Hello and welcome to another edition of the Watchful Citizen. My name is Benny Shope and I'm your host. This is a local cable access program brought to you by the Lancaster County Democratic Party. Thank you for watching. Today we have as a guest Lancaster County Board of Commissioners, Commissioner Jane Raybould. Commissioner, thanks for joining us today.
Well, thank you for the invitation. I'm glad to be here.
Yeah, it's exciting to have you on and hopefully you can help me understand a little better what's going on. Let's talk about the county board. What is, lots of people in Lincoln and Lancaster County know about the city council. They know about the mayor, but we don't talk a lot about the county board. Tell me, what is the Lancaster County Board?
Well, you know, that's such a common question. And when I was campaigning, people really don't understand what the county board does. And so I asked people, do you pay property taxes? And they said, yes, I pay property taxes. They're too high. And they said, and I say, well, you know, the county board could be your worst nightmare because that's one of the functions of the county board. We set the tax levy, and that greatly impacts how much you pay in property taxes. And in addition to the tax levy, we set the county board budget and the county budget for all the department and agencies in the county. We manage the county funds. We have oversight over that. We have management and oversight over the county property, and we have obligations and administrative oversight on many different departments that by statute we have to administer. So the county board has a lot of responsibility, and sometimes people just really don't understand.
Yeah, my eyes are still a little glazed over.
Yeah.
I know. So
Budgets.
You said establish the property tax levy.
Right.
So I pay city taxes and county taxes?
Yes, you pay, the city has a levy and the county has a levy. The public school system where you reside has a levy. If you're in the rural areas of the county, the rural fire department has a levy. There's a number of JPAs, joint public agencies, that have a levying authority. So it all combines into a wonderful tax bill, property tax bill that you get. And that's something that the county board reviews and approves, but of course each of those entities does have the levying authority. The smaller towns in the county, Hickman, Bennett, and Waverly, they all have their own elected officials, and they determine what their levy is, and we just authorize that levy to make sure it's in line with what their caps are. So
when I thought I was paying taxes to the city of Lincoln, I may have been paying taxes to Lincoln, but I paid it through the county.
That's correct. It's all collected through the county treasurer. So all that money is funneled through the county.
That's helpful. Thank you. I was a little confused about that.
So that's where your pain point is.
Thank you.
Right through the county. We try not to make it painful, but the reality is we've been very fortunate in the county. In one sense, the values have increased.
Yes.
And so with the increase in values, it can be maybe 1 to 5% depending upon the year. And we're fortunate in that helps us bridge our deficit with the increase in value, because we'll keep the levy the same, but because the values have increased.
The rate of tax doesn't change, but your value of your property does. So we do get a small increase in revenues collected.
Correct. But you know, people still blame the property tax. Nobody likes the property tax. And as part of the Tax Modernization Committee that have been meeting across the state of Nebraska, the early assessment is that nobody likes the property tax. They think the property tax is too high. They were looking into a fair way to restructure the property tax. There is a tremendous burden on the county and the municipalities. You know, the city of Lincoln also has access to a sales tax.
Yes.
The county does not. And so we're heavily dependent on property tax.
To provide services for the resident. To continue to
provide the services that our citizens expect us to provide. And you know, a big part of that is public safety and our jail. You know, we just opened a new jail, and as a result we've had to hire 39 new correction officers. So that puts a tremendous pressure on our budget. And so with the addition of 39 correction officers, we have the salaries, the compensation package, and that's a tremendous burden on us. You know, there's no doubt that the old jail was overcrowded, and we had to partner with a lot of the counties like Platte and Dawson to help with the overflow and overcrowding. And so, you know, we're bringing those inmates back.
And saving us money.
saving us money, but actually it's costing us more for the new correction officers than what we're saving. We really had a great deal going with those counties in taking the overflow of the inmates. You know, they gave us a great deal of $45 a day for that service, and they would even transport them to and from court if they had arraignments as needed. And the reality is the costs have increased significantly to operate the new jail. It's important. It's a very important function of the county, and it's part of our public safety that we offer, and we're statutorily obligated to offer. But there's a lot of pressure with this additional employees that we have to bring on. So
I want to talk some more about that, but I'm going to back up a bit and go back to the definition of the board and understanding. You are a county board member.
I'm a county board member.
How many board members are there for Lancaster County?
Well, there are 5 county commissioners, and there are 5 county commissioners, and we each have a separate district. I represent District 1, and
where's District 1 located in relative geography for the county?
Okay, when I was elected in 2010, and my term started in January of 2011, my district, and as all the districts, included a chunk of the city of Lincoln, kind of like a piece of pie, and radiating out towards the rural areas. So we each had a small chunk of the city, and then also a parcel of the rural areas. And after the 2010 census,
and we did redistricting?
We did redistricting, and so my district kind of shrunk up to incorporate the center of the city, and I had just like a little sliver of the rural area, not much at all. But also the other county commissioners, they have just a little sliver of the city and primarily the rural areas. And so that was a very tough issue for me, because I was concerned that there was a lot of inequity in terms of the voters. So for example, in my district, you know, you would think I would be just giddy with happiness, because in my reconstructed district, it has a majority of registered Democrats. I'm a Democrat. So why wouldn't I be thrilled? And historically, these registered Democrats vote democratically. So for myself or any other commissioner who wants to run for office, they're guaranteed a position. But that means that all those other districts are now primarily Republican, with a majority of registered Republicans. And historically, they vote Republican. So that means that we might have this one island of a Democrat surrounded by 4 other county commissioners. Is it a good and bad thing? Perhaps. I think time will tell. But
so does that make you an urban county commissioner?
I'm an urban county commissioner.
I understand. And so with this restructuring, it's a little less. Well, let's go differently. I live in the city of Lincoln. I don't understand why Lancaster County is involved at all. I don't live in Lancaster. I don't live in the county. I live in the city.
Well, if you live in the city, you're also in Lancaster County.
So, okay, do that again. I'm sorry.
So if you live in the city,
yes,
the city is inside Lancaster County. So
I'm also a county resident and a city resident? And these services that are, how do you just, you know, I drive on city streets and roads.
But we have many different functions. You know, we have 2 different municipalities and political subdivisions that are charged with different duties and obligations. So, for example, we, as a city, we're very fortunate that we have 6 jointly combined departments. So it's purchasing, it's planning, it's personnel, it's human services, it's the health department, and it's our information services. So we look for ways of creating efficiencies. And I think Lincoln and Lancaster County is light years ahead of other counties, certainly in the state of Nebraska. Based on our size, we really are trying to strive to find efficiencies. And I think we've done a great job. We have 43 interlocal agreements, so there is a tremendous amount of collaboration and cooperation going on. Why are we doing this? Well, I think we've been so progressive, and I can't take credit for this, and my predecessors can take credit.
Take the credit.
Well, I'll take some of the credit for making sure that we continue on this track of progressive ideas to look for ways where we continue to have consolidation and create efficiencies for our taxpayers. Because, as you know, government is expensive, particularly with personnel, benefits, the cost of health insurance is increasing. So there's a number of increases that overtake where we get increases in the value of property that can compensate that. So we're always struggling to try to maintain a budget. We're struggling very hard not to increase your tax levy and still deliver the same level of services that people expect. To make sure, you know, I think people will say that they love living in Lincoln and Lancaster County, because it's a great place to live, work, and play. We have just wonderful efficiencies going on in our government. We try to give the taxpayers the best deal possible out there. And it's a challenge.
I do enjoy living here. I have access to wonderful resources within the city, parks, trails, facilities, shopping, and all the other things I need. And then I'll have small recreation areas outside of the city, just on the edge of the county. So I am enjoying lots of those things. And I thank you for explaining the joint arrangements, because I wondered, how do you divide up what the city does versus what the county does, and where do you draw the lines? So there's some interagency cooperation to cover that.
There's a lot, and you know, for example, as a county commissioner, on Tuesdays we have our regular public meetings that are televised, which is great. They usually last maybe an hour.
What time of day are those meetings?
Those are on Tuesdays at 10:30 in the morning. And then on Thursdays, we have our staff meetings that help us prepare for all the issues and items that we're going to be dealing with at the Tuesday meeting. And those go from 8 to 12. But in addition to that, we have obligations to many other committees that we attend throughout the week. So for example, I'm on the Public Buildings Commission, where we look at the management of both the city and county property. I'm also the chair of the City County Commons. So that's when the City Council and the mayor gets together with the county board, and we deal with common issues of concern, and we discuss and talk about those. I'm on the Joint Budget Committee, which is a city-county committee partnered with the Human Services, and we look at issues and funding for different programs that are provided to the city and county by the nonprofits in our community that the city and county can no longer afford to offer this type of human services and community support. So it's a great deal and a great bang for our buck. I'm also on the Community Health Center Advisory Board, which is an important topic that I hope we'll get into to discuss.
Let's talk about that topic. You started talking about delivery of services and how there's a joint budget. And Lancaster County is in the process of shifting from publicly providing mental health services to a private organization contracted through Region 5 Systems.
Correct.
Tell us what's the progress of that transition.
Well, you know, this transition has been a long process, and I think it's been a very beneficial process that we have been able to slow it down and really examine the depth and breadth and the number of programs that our community mental health center in Lincoln and Lancaster County provides to those consumers. I mean, the process started out in 2011, in April of 2011.
Your first year.
Yeah, my first year. And so
great way to get your feet wet.
It was a great way to get my feet wet, but it's so important that we understand the whole complexity of the delivery of behavioral health, mental health services to those that are most vulnerable in our community. And this is something that I'm tremendously committed to ensure the seamless process of the transition from the county support and funding to that of non-profit private providers, to make sure it's seamless and it's successful. I know that we've heard horror stories about the foster care system, and that's why we just slowed the process down. And throughout this process, we worked with the Community Health Endowment, Lori Seibel. We worked with Leadership Lincoln, Dean Finnegan. We reached out to the community to get their input. We had town hall meetings. We had other meetings that involved the consumers, the recipients of this service. We worked with the families of the consumers. We worked with the employees at the Community Mental Health Center. We worked with the private providers out in the community that currently provide mental health services, behavioral health services, to make sure that we understood exactly where we need to go with this process and the transition. And then we formalized a committee to really research and understand it, and thanks to the Community Health Endowment and the funding they provided, we reached out to Health Management Associates. It's a national consulting firm looking at the whole issue of how to deliver primary care, how to deliver these mental health services, and they evaluated the city of Lincoln through all kinds of agencies. How can we better deliver these services? How can we more efficiently deliver these services to benefit a greater pool of the people in our city and our county? And the one thing that they recommended, and this is what you're hearing time and time again, to look at the delivery of primary health care integrated with behavioral health. And it has to be integrated because you're dealing with the whole person. You just can't have a silo dealing with your maybe mental health issues or alcohol and substance abuse, and from your physical health issues. It's all combined, and I think that was the recommendation of the Health Management Associates, that we look at trying to come up with a more efficient way of delivering these services and partnering with the nonprofit providers in our community. So that's the recommendation they made. We formed an invitation to negotiate committee, which was looking at trying to come up with a collaboration of all those providers in our community to partner and come up with ways to offer these services and the integration of primary healthcare with the behavioral health. And so
how are you going to do that?
Well, and I want to go back and say that, this whole process has taken, we're at 2 years, and
Yes.
what we reached out, we received over 500 comments from the consumers and families of the consumers, the employees at the community health center, trying to really gather and come up with the best game plan possible. And so the invitation to negotiate was that idea to really collaborate, get these agencies to combine and collaborate. And so we reached out, working with Region 5, so they came up with the qualifications, requests for qualifications, and requests for proposals. Throughout this whole process and sort of long convoluted way of explaining this, we were able to have several people interested, or entities interested in bidding on these services. The county was going to always maintain the crisis center. That is
Yes.
something that we're statutorily obligated to provide, the crisis center. So that will always be under the county authority. But we're looking at the community mental health center and the core services and community support that they provide. And Lutheran Family Services
Thank you.
has stepped up to the plate, and they're willing to take this on. Lutheran Family Services has been involved in our community for quite some time.
And I'm sorry, I can't remember the name of the other 2 agencies that are also participating.
And Centerpoint is
Centerpoint.
taking on one of the components, which is our day rehab. It's an adult care facility, but it's more than adult care. It's programs, it's job training, and it's supervision during the day. And that's at Midtown Center. So there's a number of job training skills, food service skills that they learn to be able to go out in the community and have employment and be fulfilled. And so that's what Midtown does. Centerpoint took on that role. Lutheran Family Services took
That's
on
2.
the main bulk and core of the delivery of the mental health services. And the third entity is the Heather, which is Psych Res Day Rehab. And
That's a mouthful.
it is really a mouthful, but it includes overnight care for those that are transitioning from the regional center, which is for those that might have been committed there for additional care and treatment to get you back on your feet. So this transition facility is a 15-bed facility, and it's called the Heather. And so we're looking, Omni Services initially said that they would take it on, and then they had to back out, and so now it is out for request for proposal. And I think, as far as I know, Region 5 has received inquiries and interest from 3 different entities. So that will go out to bid shortly. Centerpoint has already transitioned Midtown effective October 1st. So Centerpoint,
So it's already underway.
and that was seamless and flawless,
I want
and did a great job.
to go
Yeah.
back to one of the things you said
Sure.
earlier about this, and I was a little surprised. You said these are nonprofit agencies.
Correct.
Now, I don't understand. I assume most of these agencies were for profit. That's why they're doing it. So these are nonprofits. So it's really cost efficient for the county to do it this way.
It is. It's really cost efficient, not only
No
for
one's
the
getting rich from doing this.
No, and it's really efficient for the county, and it's really efficient for the taxpayers across the state of Nebraska, because Region 5 is encompassing, I think, 13 different counties, and they're the major funder for a number of the services that are contracted out. In addition to funding from the state, there's funding from Medicaid reimbursement for the services these consumers need.
Okay.
And so there's
Right.
revenues coming in from both the state and
The federal
and
fund.
federal.
And they're taking
funding.
care of the administrative portion of that.
That is correct. And so, I mean, it's a challenge. I know that is a big concern with
It is.
the today, and it'll always be a concern, because there is a growing need. There is a tremendous need to understand mental health issues and to be supportive and to destigmatize that in
Yes.
our community. So many people have family members or friends out in the community that suffer from this. in many cases that can be a biological issue that can be treated with medication. And medication management is a critical component of the community support that Lutheran Family Services will take on, just as the Community Mental Health Center has been the provider of that. In the transition process, Lutheran Family Services is on track to take over December 31st, January 1st of 2014. So that's the next transition step. Centerpoint is already on board, and this is our commitment as the county to make sure it is seamless, that there is no consumer that falls through the crack. And we've provided funding. Our funding level has stayed the same throughout this whole process.
Hasn't cost the county any more money.
It hasn't cost the county any more money because we want to ensure that it is a success. And what we're also doing that I don't think a lot of people know, we've partnered with the University of Nebraska Public Policy Institute, and they're actually tracking this whole process of the transition. And they have benchmarks. They're working with the consumers, integrating the consumers to make sure they feel comfortable, getting their ideas and their thought process on how it's going, working with the providers to make sure that this transition process is something that we can be very proud of and use as a model to other communities across Nebraska and across the United States. So that's the commitment we've made to the success of it, because we understand it's so important with the integration of primary care with behavioral health, because you just can't separate and divorce the two without treating the whole.
You have to treat the whole person.
And so hopefully we're being very innovative in this process. It's a scary process. There's no doubt about it with change. And we wanted to reach out to the consumers to give them the assurances. We've had a number of programs on TV. We've had the forums, but we need to be better. We need to keep communicating, and that's our goal, to make sure that they are comfortable and that the community understands that we're doing everything we can to assure a smooth transition.
Before we move on to another subject, I'd like to ask you some statistics about that. About how many people does Lancaster County in this transition period deliver services to? Can you give me some?
Well,
and how many people are in need?
Well, I'm not sure I can give you the definitive answer of the number, because a lot of the cases, an individual may have a co-occurring.
Yes, comorbid, yes.
They might have a mental health issue, but also an alcohol and substance abuse. So it's really hard to separate that. And I think that was one of the problems as we were transitioning, to be able to say, well, this person is on this program, but this person is also getting support from this program, because of the complexity of the issue. But we also partner with the Lincoln Police Department. They're the first responders.
Yes, often they are.
And we are so fortunate that the Lincoln Police Department is well trained in being able to diffuse a situation, domestic disturbance, and being able to get that person to the right facility they need. Is it the crisis center? Is it Bryant Health for their mental health facility that they offer? It's the Lincoln Police Department. And so when we were talking about working with UNL Public Policy Institute, tracking the benchmarks, are we seeing any increase in those calls for disturbance? Are we seeing an increase in the inpatient commitments to the crisis center? Or are we seeing an increase in the Lincoln Region Center? Or are we seeing an increase in hospitalization? So these are things that are benchmarks and numbers that we have to track. So
I was asking you, could you give me a number, and you really weren't comfortable doing that.
Yeah.
But after the Policy Center for Instance Research, you'll be able to better answer that question.
We'll be able to show you exactly how the program is trending.
Excellent. So let's change gears for a second and go back to something you mentioned earlier. You mentioned that we were hiring 39 new correctional officers.
Correct.
How many employees does the county have at present?
The county has roughly about 190, 195 county employees. Now this will be in addition to that. So they've been trickling in additional correction officers because they have to go through extensive training to be able to do their duties and obligations on that. So that's something that we're concerned with, because again, it puts a lot of pressure on our budget.
So, and the county jail is here. We're going to keep it.
It's here to stay, and that's one thing that I was concerned when I ran, that we have to, and this is one of the things that I really want to engage the community in. It's so important. Now we have the jail. It's open. 98% of all the inmates have been transferred into this new wonderful jail. It has a capacity of 761. Right now we're at roughly 600 inmates. So
wow,
I know. So my big concern, and this is a concern that's all over the state of Nebraska, all over the United States, we have to come up with alternatives to incarceration.
Yes.
We have to. And I think Lancaster County, again, is very progressive on it, but we need to be better. You know, we're very fortunate. We have a community correction that looks at getting these people diverted out of jail, the low risk, those that have a nonviolent background. They can be redirected. They can have home detention. You know, those are the ankle bracelets, the monitoring, you know, for those that have DUI, ignition locks. We want them to go to work. We just don't want them to drive while drinking. You know, that's a critical thing. They need to be productive members of our society. They need to be out there, but we have to keep society safe. And these are steps in the right direction. For those people that can be diverted, they should be diverted out of jail. Could they get probation? Could they be directed to a community support program that'll deal with their addiction, be it alcohol or substance abuse? Do these people need to be in jail? No, and particularly those that have mental health issues. They don't need to be in jail. We need to be all over that. And the reason why the taxpayers need to understand is that the delivery of these services is so much more efficient outside of jail.
Yes.
The cost of incarcerating them is so great. Now, do bad guys need to be, and bad women need to be incarcerated? You bet. We're not saying that that's not the case at all. Those that are violent, that are predators towards children, but we can analyze the situation and reach out. Other communities are looking at that. They're embracing programs that offer support to those inmates that get out, or offer support and treatment to those that shouldn't be incarcerated. So I mean, that's, I think, we don't want that jail to fill up so quickly.
It sounds like you're getting close already.
Well, you know, that's pretty much the population count.
The numbers you said, oh, it does fluctuate. The numbers you said, wow, we're almost at capacity again.
Well, 600, we still have about 760, but you know, it fluctuates. It can go from anywhere from 525 up to 600, and I think it's trending up higher. And that's a scary thing.
It is.
We don't want to be at capacity, but we do have to look at alternatives as other communities are looking at.
So briefly,
Yeah.
how is the county board addressing are there programs, funding studies to look at this transition, different ways of I don't want to say incarceration or punishment, but different ways of addressing the population?
Well, you know, each different organization, certainly the community corrections is one, but you have to work with the judges, you have to work with the county attorneys, and you have to work with the Nebraska legislature on this. Sometimes people would like us to be really tough on crime and change that DUI to felony conviction. You know, I'm not saying that DUI is a horrific crime. It's a horrific crime. But to make it a felony conviction requires a higher level of court involvement, attorney involvement, and that costs the taxpayers money. And
Well,
do we want to really focus attention on getting that person treatment, getting him out of the jail system?
And rehabilitating them.
And rehabilitating them. And that's where there will be efficiencies. But because folks are getting these felony convictions, that really impacts them as they come out.
Yes, it kind of puts a stigma on them for the rest of their life.
It puts a stigma on them the rest of their lives. You know, we're fortunate in Nebraska to have very low unemployment, but if a person comes in with a felony conviction and they're asking you for a job, and you have another candidate that doesn't have a felony conviction, it seems logical that that employer, and it's important to educate employers to really reach out and give folks another chance. They really need another chance, and it's risky, but we want our community to be better, and we want these folks to be integrated back in our community.
Well, I'm sorry to tell you that we're out of
We're out of
time
time.
today. Yes,
Oh,
I really want to
no.
talk with you about the Tax Modernization Committee and a couple other things. I hope
Yeah.
you'll come back on our program in the future and we can talk about
Okay.
some more stuff.
That's wonderful. Thank you.
Thank you. I'd like to thank Commissioner Raybould for appearing on our show today. You've been watching The Watchful Citizen, a local cable access program brought to you by the Lancaster County Democratic Party. Our program airs on Time Warner Cable Channel 13. You can catch rebroadcast on Tuesday nights at 10:30, Wednesdays at 6 p.m., and Saturdays at noon. You can also follow us on YouTube at Lancaster County Democrats. My name is Benny Shobe. I'm your host, and thank you for watching another episode of The Watchful Citizen.
That went